What is the global effort to end cervical cancer? Imagine a world where cervical cancer is no longer a threat. That's the goal of a worldwide movement led by the World Health Organization and supported by governments, health groups, and communities everywhere. This effort aims to eliminate cervical cancer as a major health problem by 2030 and beyond. The plan focuses on three main areas: prevention through vaccination, early detection through screening, and proper treatment for those affected. The most important part of prevention is vaccinating girls and young women against high-risk human papillomavirus, or HPV, which causes most cervical cancers. The target is to vaccinate 90% of girls by age 15. Countries are expanding vaccination programs, sometimes using just a single dose to make it easier and more affordable, especially in schools and community clinics. Screening is equally vital. The goal is for 70% of women to be screened with high-quality tests by ages 35 and 45. Screening methods like HPV testing and Pap smears help find abnormal cells early, before they turn into cancer. Detecting these changes early allows for treatment that can prevent invasive cancer from developing. Treating women with precancerous lesions and invasive cancer is the third pillar. The aim is that 90% of women with early changes receive proper treatment, and 90% of women with invasive cancer get the care they need. This comprehensive approach, vaccination, screening, and treatment, is often called the 90-70-90 strategy. Achieving these targets could prevent nearly 40 million cases of cervical cancer and save over 35 million lives in the coming decades. A key part of this effort is ensuring that everyone, especially underserved populations and those in low and middle-income countries, has access to these life-saving services. Political commitment and international cooperation are crucial to making progress. Countries are working to integrate HPV vaccination and screening into primary health care, raise awareness about risk factors, and combat social barriers like stigma and misinformation that prevent women from participating in prevention programs. While cervical cancer is linked to HPV, other reproductive cancers like testicular cancer have different causes and prevention methods. Still, the success of this global initiative highlights how vaccination, early detection, and treatment can dramatically reduce the burden of HPV-related cancers. Overall, this worldwide effort is a comprehensive, science-based campaign aiming to make cervical cancer a thing of the past. It relies on international teamwork, strong policies, and equitable access to health services. If these strategies are fully implemented, we could see a future where cervical cancer no longer causes unnecessary suffering or loss of life. Remember, if you have concerns or want to learn more about prevention or screening, always consult with a healthcare professional for personalized advice.